Welcome back to the Arise interview. I'm Charles Onyegulu. Now, Mohammed Abubakar, son of the former Nigerian Vice President Atiku Abubakar, who's in quarantine after testing positive for COVID-19, has a message for Nigerians from his treatment center. He's helped to raise $5 million to battle the outbreak in this country through the Africans Preventing Poverty Foundation. The foundation intends to use this donation to subsidize the purchase of COVID-19 test kits and personal protective equipment such as face masks, disposable latex, surgical gloves and hand sanitizers. We'll hear from the head of the foundation in a moment. But first, here's Mohammed Abubakar, son of Atiku Abubakar, speaking from his treatment center from where he is being treated for COVID-19.
On the 20th of this month, I tested positive for COVID-19. And later that night, I was brought over to the isolation center at the Gwagwalada University Teaching Hospital here, where I've been since. I'm currently on my 11th, going on my 12th day here. I hope to be out soon, perhaps when my next test is taken and the results are favorable. I will be on my way out, hopefully. But I decided to do this video just so I could speak about my experiences, and I hope it will be of help, of value to the society and to people out there, Nigerians in particular. When I came here, my first few days, I was asymptomatic, but I was nervous. I had a level of anxiety, a little bit of trauma. So it was fairly difficult few days, especially being the index case or the first case here in Abuja, so I think that was really the main challenge. But day by day, I grew stronger, in mind. Thanks largely to all the goodwill, the prayers, and the support I got from a vast array of Nigerians, many people I don't know, but of course, more obvious, my family, my friends, my associates, and just a whole lot of people who've been very supportive. So we thank God I'm well and I'm good. But one thing I'd like to speak to Nigerians about that I experienced, fake news. Fake news is very bad. It compounds your problems if you're in a vulnerable situation. Perhaps being from a political family, I didn't really feel that pain as much. But people who are more vulnerable, this thing could, really affect their health. It could affect their immune systems as well. So let me urge people out there to be very circumspect in how they treat information. Let them be careful in spreading information that is false. These things aggravate health conditions. So in my case, even people within the estate that I lived in were purveyors of fake news, and it's quite unfortunate. But I'm not really here to talk about those specifics. But I'd like to urge all of us to come together and see how we can support one another, because this is a challenge to our society. It's a challenge to our future. It's a challenge to the present. So we need to, the quicker we come together and understand that this is a problem that requires a collective effort, then the sooner we overcome this. The longer it takes to do that, then the more the impact in terms of fatalities potentially, and also the economic impact. Thankfully, as we've seen the numbers and statistics, Most people will be fine from this, but we can't ignore the few that may not be fine from this. So let's work hard, let's support the government, let's comply with directives from the WHO, the federal government, state governments, etc., so that we can overcome this challenge sooner than later, Nigerians. Moving on, I'd like to also ask that we pray and show our medical staff a lot of support. They are at the front lines, they are risking their lives. I've seen it firsthand, how close they come to patients, how exposed they are. And we need to pray that none of them get infected, nothing befalls them, any kind of harm to them or their families, right? Because they're our backbone, and we have to appreciate and be thankful to them. We have to be thankful to also the authorities, the extended authorities who are not necessarily on the front line, but are playing a lot of role in other aspects. So Nigerians, in essence, we're saying, let's come together, let's put aside politics and defeat, this pandemic. We can do it, and we can do it very effectively if we work together,
Mohammed Abubakar there speaking to us from his isolation center in Abuja, where he's being treated for COVID-19. Well, let's speak to the head of the Africans Preventing Poverty Foundation, Joseph Orike. And of course, that foundation has just been helped to raise $5 million by Mohammed Abubakar. Thank you very much indeed, Joseph, for coming in.
Thank you for having me, Charles.
Tell me about your foundation.
Well, the foundation was started around 2 years ago. And myself and Mohammed's brother, Abba, we used to have lengthy conversations about the issues in Nigeria, in the micro, and in the macro, the issues of Africa, and the extent of poverty in Nigeria, and what young people like ourselves who grew up in more fortunate situations could do to help, alleviate some of this suffering and pain. So we thought that we'd create a vehicle to do this. So we incorporated this foundation, and we named it Africans Preventing Poverty, because I think it's a time that Africans took ownership in the prevention of poverty. It always seems as if we are always going with our begging cap to the Europeans, to the Americans, to the Japanese, to whoever. And it was about time that, as the saying goes, that charity begins at home, that perhaps the more fortunate amongst us could get together and do something for our relevant communities. And in that process, we thought, well, what are the main issues that we have in Nigeria? We have tribalism, religious polarization, all these kind of things. So one of the core values that we implemented in our organization was equality. So we have members who are, Muslims, Christians. It's not politicized at all. We have APC supporters, we have PDP supporters, we have people from the 6 geopolitical zones in Nigeria, and we've all come together for this good cause, and that is trying to help people who are lesser off. But we didn't actually want to make it a conventional charity. We thought it's better to empower people. As the saying goes, teach a man to fish rather than giving him a fish. And as we were both very much into technology, we thought we'd actually implement technology, to achieve this aim. So we also implemented such systems as distance learning, e-learning schools. Even with this donation that we've got from our US partners, we'll be facilitating it with blockchain, so that we're not just giving bags of cash to people, which can be misappropriated. We know where every penny is spent, because these tokens will be redeemable in supermarkets, in affiliate partners that we have. So we thought we'd put a lot of thinking towards it. to make sure that the money actually goes into the right hands.
Well, that's very interesting, very innovative,
Yeah.
very sort of 21st century, while at the same time doing things to help people. I want to talk about the technology parts of it a little bit later when we come back from a break. But I mean, before we go on that break, what's Mohammed Abubakar's involvement with it?
Well, obviously, I mean, his involvement is through his brother. I mean, his brother has involved other members of his other siblings, should we say, you know, in this movement, because they're all, you know, they're all very passionate about helping other people. And I think it's something that, you know, has, especially in the context of the COVID-19 crisis, has, you know, it's touched their front door with one of their siblings actually, unfortunately, contracting this disease. So, you know, it's more than ever, it's important to mitigate the you know, the effects of this crisis, you know, which we're facing.
All right, Joseph, stay with us. We want to talk to you some more. You're watching the Arise interview. Plenty more still to come. Stay with us. Welcome back to the Arise interview. I'm Charles Enyekulu. Now, as you may have heard, Mohammed Abubakar, son of the former Nigerian Vice President Atiku Abubakar, recently tested positive for the COVID-19 virus. He's a member of the board of the Africans Preventing Poverty Foundation, and he's helped raise $5 million to fight the outbreak in Nigeria through the foundation. They say they're going to be providing edibles such as rice, tomatoes, sanitizers, and also personal protection equipment, as well as other items to be distributed across several locations in the country. Now let's speak more to the head of the Africans Preventing Poverty Foundation, Joseph Orike. Thank you very much indeed for staying with us.
Thank you, Charles.
And it's very interesting that you were able to raise $5 million fairly quickly. I mean, was that something you were already working on, or did it happen when Mohammed Abubakar tested positive and everybody suddenly woke up to the fact that this is real?
No, it was actually quite serendipitous because we were in the process of accessing these funds, you know, for charitable causes. And actually, you know, we do have some good news. It's actually in 2 phases. The total will be $10 million.
Right, okay.
But, you know, first of all, they want to make sure that the first $5 million is distributed, you know, as promised.
Yes.
And then we'll be able to draw down on the next $5 million.
So who's giving you all this money?
Oh, well, we have American investors, which run a hedge fund, which have, I think, just under $3 billion under management. And they invested in another company that I'm involved in. It's called BitFXT. So this is the blockchain company. So the company develops blockchain solutions. It also is the company that developed the wallets for the tokens that we'll be using. So we kind of drew, you know, all our resources together and contacts, and we're able to make this great thing happen.
And I mean, you've heard us talking in the last 45 minutes or so about this contact tracing app. I'm just thinking, I just want to get your thoughts on it, given the fact that you guys appear to be very technologically savvy. I mean, would that be something that you think might work in a country like Nigeria?
Well, it depends. I mean, there are other issues that you have to kind of weigh the cost-benefit analysis. And earlier on, you were talking to the human rights lawyer about, you know, the invasion of people's privacies. But, you know, in terms of human rights, you know, when you've got such a serious situation as we have, which is you know, a public security, public health actually situation, you have to just make a cost-benefit analysis. And sometimes, I mean, as you can see all around the world, even in developed countries such as the UK, United States, you know, people have had to give up some of their rights.
Absolutely.
You know, in order for the greater good, you know. So in the aspect of Nigeria, we just have to kind of look at the figures and perhaps, you know, assess the amount of people who are actually have access to internet through mobile phones. If I'm not mistaken, I think it's about 40% of the population have access to internet through mobile phones. So, you know, you have to see that if, you know, this amount of people, and then let's say out of the 40 million, let's use a figure of 50%, 20 million, whether the benefits of that would actually be effective, would produce any positive results. I would rather go towards a more low-tech version. I don't think that the measures that have been implemented are actually domesticated and suit the environment of Nigeria. This is not the United Kingdom or America. What I think a lot of people fail to realize is that most people in Nigeria live hand to mouth. So what you work for today, you spend tomorrow. I myself have been wondering how long people will be able to stay, you know.
Well, that's actually what makes this thing very important.
Yes.
This a different form of contact tracing, because and a way of getting around the lockdown. Because the point you're making is very important. You know, whether or not how long people can last in this sort of situation, because they have to go out every day and earn a living. And therefore, the longer you keep them locked down, the more difficult it is for them to earn a living. And the government has limited resources, also limited data, to be able to actually know where people are, if in fact they have relief materials or whatever, to be able to deliver that, or cash payments and so on. So it's a big challenge, and that's why this app is being suggested. You see what I mean? As a way of minimizing the lockdown, but still able to do more targeted contact tracing.
Well, as I said, once again, you know, it's a cost-benefit analysis, and I think that you could actually go low-tech. I myself personally, and this is just my personal opinion, I don't want anybody to take upon this advice.
Sure.
I think that we have to look at the demographics of Nigeria, and we look at the demographics of Europe. If we study the demographics of Nigeria, you find that the majority of the population is between 1 to 30. Now, most of the recorded deaths, you know, are people who are over 60, or those who are under 60 are usually those with underlying health conditions. Fortunately for Nigerians, you know, the average life expectancy is 56 years old. So the majority of the population isn't at high risk, in my opinion. So perhaps, you know, we could employ methods such as countries like Holland, where they haven't really restricted movement too much, I think, until recently. You know, we could perhaps use, you know, the government agencies such as the military to make sure that people, you know, don't congregate in groups more than 3. Places such as supermarkets, maybe you have reduced to a third of the people who are inside such a small enclosure. I think we could go low tech, because I think what you're eventually going to have is a situation where, you know, if the end result was fatal, are you going to starve to death, or are you going to die because of COVID-19, causes related to COVID-19? The end result is the same. You know, so I think they have to look further. The whatever measures are implemented have to be tailored for Nigeria, not a copy and paste of United States or Italy or wherever. You know, I think we need to have you know, bring some formulate some think tanks, and create measures that suit Nigeria more specifically.
And I mean, do you think, you've been working with Mohammed Abubakar and the family and so on, Mohammed, of course, the son of the former Vice President Atiku Abubakar, and Mohammed has tested positive for COVID-19. I mean, he's been in quarantine for a while now. We saw his video earlier. I mean, are there any lessons that Nigerians can learn from his experience? Because, I mean, here he is, he's a reasonably young man, and yet he caught the disease. Obviously, in his case, it's not going to be fatal, but what it suggests is that potentially you can catch that disease and spread it to other people. What are the lessons there for Nigerians, particularly young people?
Well, I think the lessons there for Nigerians is that this particular virus doesn't really discriminate whether you're rich, you're poor. You know, you have a potential to catch it. I think we want to take a more preventative stance towards it, rather than one where you treat it once you've got it, because I think on the latter we don't really have the facilities. So I think if we maintain personal hygiene, we wash our hands regularly, we implement, you know, these systems such as social distancing and limit our movement, you know, to only you know, the most necessary movements, then we can mitigate and limit the rates at which that this virus spreads.
But of course, Mohammed Abubakar comes from a very wealthy, very upper class Nigerian family. But as people have been pointing out, I mean, if perhaps there wasn't a travel ban and so on, he might have been evacuated from Nigeria. I'm not saying he would, but I'm saying he might have. He would have had that option of going abroad. But now people like himself are forced to stay in Nigeria and use the medical facilities of this country. Your foundation is there to fight poverty and improve the living standards of people, which includes health. Do you think this is now going to focus more attention on the health facilities in this country?
Definitely, because as the saying goes now, we're all in the same boat. So it's in all our interests to make sure that, you know, facilities, health facilities are up to scratch. As you said, you know, there are travel restrictions. You can't just be whisked out of the country, you know, and nobody really knows how long this is going to last. I mean, it's my personal bet that this is not going to be a short-term thing.
Right.
I think.
Okay, that's going to have to be a discussion for another day. But I want to thank you very much indeed, Joseph Orike, who is the head of the Africans Preventing Poverty Foundation, and to congratulate you for raising $10 million and trying to use that to mitigate some of the challenges for people who are less well off in this country as the disease takes hold. Thank you very much indeed.
Thank you for having me, Charles.
That's it for this edition of the Arise interview. Do join us again tomorrow from me and the entire team here in Abuja. Bye-bye, and thank you for watching.